Genetic Testing for Bipolar Disorder by Addie, Sam, Jacob, and Lee. Background information about bipolar disorder. Bipolar disorder is a mental illness defined by erratic mood swing. People of all ages can be affected by it, but typically develop between young adulthood and 35. People whose parents have bipolar disorder are also more likely to have the illness as well. The heritability of bipolar disorder is 76 to 93%. According to Dr. Chang and Dr. Galley research, bipolar disorder is linked more to genetic than environmental causes. About 79 to 93% is attributed to the genetic.
SNP chip test designs. We will test around 10 different alleles to get specific results for our SNP test. Two SNPs that we chose to use were the versions RS2159100 and RS140504. These two variations affect bipolar disorders, and these SNPs are also associated with a 1.4 times increased risk of developing the disorder if the variation is AA and AG, or with the RS number 2159100 is associated with the bipolar disorder 2 if you have the variation TT, which increases to 2.36 times. If this allele specifically doesn't form correctly, it affects the ADCY2, which then causes bipolarism in the brain. This gene codes for messaging enzymes in the brain, so if it's not formed right, it won't form properly. These two SNPs that we chose definitely impacts a person, so when doing genetic testing, these would be the two that a person would specifically focus on.
Benefits and limitations of the genetic testing. Genetic tests could show increased risk of becoming bipolar. However, many of the genes will only increase the risk by a small amount. Knowing that you have an increased risk could allow for planning and preparations to be put in place. A doctor could be notified and have a treatment already planned out, and the patient and their family could know which symptoms and signs to look for.
Warnings and ethical considerations. There's the cost of the genetic test to take into account. Health insurance might be more difficult or expensive to obtain once you've had a genetic test. There's also the mental stress of knowing that you have an increased risk based on bad genes. The end.